Three.
Our presentation will be on disaster response. Disasters such as hurricanes, wildfires, mass shootings, and pandemics create extraordinary challenges for nurses on the front lines. In these situations, nurses must balance their duty to provide care with complex ethical, legal, financial, social, political, and regulatory concerns. Ethical dilemmas emerge when resources are scarce, forcing difficult triage and allocation decisions. Legal and regulatory frameworks, including crisis standards of care and liability protections, define how nurses can act while safeguarding themselves and their patients. Addressing these interconnected issues is essential to ensure effective, equitable, and professional nursing care during disasters in the United States. Allocation of scarce resources is one ethical issue that nurses face. Nurses may need to decide who receives life-saving interventions, such as ventilators, medications, ICU beds, when supplies are limited. This raises questions of justice, equity, and triage because nurses may need to help prioritize those most likely to survive versus those who are critically ill. It also raises the question of duty to care versus personal risk. Nurses often must weigh their professional obligation to care for patients against risks to their own safety and that of their families, such as exposure to infectious diseases, like we saw during COVID-19, or physical danger, such as active shooter or structural collapse. We also are presented with challenges such as altered standards of care. In declared disasters, the standard of care may shift from individualized, comprehensive care to good enough care for the greatest number, which can conflict with usual nursing ethics and professional standards. In chaotic situations, obtaining informed consent or respecting patients' preferences can be difficult or impossible, especially when communication systems fail or time is limited. Ensuring fair treatment for marginalized or high risk groups, such as elderly, disabled, homeless, or undocumented individuals, can also be challenging when systems are overwhelmed, raising the question of equity in vulnerable populations. Further, nurses may experience guilt, grief, or trauma after making life and death decisions or providing suboptimal care due to system constraint, leading to moral distress and burnout. During disasters, nurses may be asked to perform tasks outside their usual scope, such as advanced area management or prescribing medications because of staff shortages. Legal risks arise if these actions are not covered by state nurse practice acts or emergency provision, leading to issues with scope of practice and emergency roles. Further, Good Samaritan, most states have Good Samaritan laws, but these primarily protect volunteers, not on duty nurses. So, nurses must understand if state emergency declarations or federal laws provide liability protection for actions taken under crisis standards. Finally, when hospitals or states activate crisis standards, the legal standard shifts from individualized care to care for the greatest good. And so nurses must ensure their care aligns with officially declared standards to reduce liability. Licensure across state lines. So during natural disasters, nurses may be deployed to other states, and they must confirm that their license is valid or that emergency privileges are granted. Even in emergencies, nurses are legally obligated to document care and report communicable diseases, abuse, or deaths despite system breakdowns. Poor documentation can result in legal claims later. Nurses also have the right to refuse assignments if conditions are unreasonably dangerous, such as a lack of personal protective equipment under OSHA rules. But refusal must be carefully documented to avoid job loss or licensure risks. Now on to Trevor.
All right, I'm going to talk a little bit more about some of the financial issues that arise with this topic. The first thing being the cost of disaster preparedness and training. So, institutions like hospitals and clinics have to invest in disaster drills, supplies, and education, which can be very financially burdensome. These aren't things that hospitals are usually equipped to deal with right away. So, It takes a while for them to raise the money to attend events like this, which they're not always prepared for. And failure to invest has a much higher long-term cost for these facilities. There's also a healthcare system strain. Disasters cause spikes in demand for emergency care, staffing, and supplies. Lots of hospitals are having a hard time even staffing their floors for a regular shift. So when disasters like this occur and they have to be staffing people to send out to the community as well as in the hospital, they have large issues with that. And this leads to potential burnout and budget overload for those facilities. And also, reimbursement is a huge issue. One part of the US government, the Federal Emergency Management Agency, and other emergency relief programs may reimburse some costs, like extra PPE, triage tents, and overtime pay. But it usually takes them months. Sometimes it takes them years to return this money to the hospital, and the nurses don't see this money for a long time. And so, yeah, hospitals and nurses often wait months or years for payment after putting in a claim. Some social issues that occur are the impact, especially on vulnerable populations. Groups like low income individuals, elderly adults, people with disabilities, and communities of color are often more severely impacted by disasters. Nurses must recognize and address health disparities during disaster responses, and this is things like access to medications, food, water, and shelter for at-risk groups. These populations may also have limited transportation or healthcare access, which increases morbidity and mortality during disasters. So, if there are groups of people that are already having issues getting to the hospital, finding transportation to places, when disasters arise, they're going to be even more affected by these things and won't be able to get the help that they need. And when it comes to mental health and community trauma, disasters cause widespread psychological trauma, including anxiety, grief, PTSD, and burnout. We often think of PTSD happening in things like war zones for veterans, but this can truly happen in any disaster zone with tornadoes, hurricanes, tsunamis, things like that. And this impacts both survivors and the healthcare workers that are there helping. Nurses must provide not only physical care, but also emotional support, psychological first aid, and referrals for mental health services. Disasters often overwhelm local resources, making this a major social concern. Some of the political issues include public health policy and funding. Disaster preparedness and response depend on public health funding, which is influenced by federal and state politics. This means that some states might get help quicker. They might receive better help from nurses and doctors than other states. And cuts to disaster preparedness programs like stockpiling PPE or funding drills can hinder effective response and put both patients and staff at risk. Another political issue is licensing and workforce regulations. Licensure laws restrict nurses from quickly deploying to other regions in times of disaster. Nurses responding across state lines may face delays due to inconsistent licensure recognition, and political decisions on interstate licensure compacts directly affect how quickly nurses can be mobilized. Some regulatory issues are the following emergency rules and guidelines, specific rules and safety procedures during disasters outlined by OSHA, often make it difficult for people to know exactly what they can do in their scope of practice. They're not sure what constitutes an emergency procedure or what they could possibly get in trouble for doing in situations like this. And the rules can also change very quickly in emergencies, like with the new virus, like COVID that we witnessed, or natural disasters. It's just hard to know what exactly your role is in these situations when it's something that you've never experienced before. So nurses must stay up to date, but again, it can be difficult to stay up to date when things are constantly changing. And sometimes the regulatory institutes don't even truly have rules for these events. And training and preparedness requirements. Special training is sometimes needed to prepare for disasters. And this is things like how to respond to mass shootings, hurricanes, or outbreaks. And hospitals must prove that their staff is trained and ready for emergencies. But again, sometimes in these disasters that come out of nowhere, it can be really difficult for hospitals to train their staff adequately. All right, and now we're going to move on to Callie, and she's going to continue.
So, disasters place extreme stress on healthcare systems, and one of the biggest impacts is on patient outcomes. A study of New Jersey hospitals during Hurricane Sandy found that reduced nurse staffing directly correlated with poorer patient outcomes. Hospitals with fewer nurses saw higher rates of complications and increased chances of long-term health issues. This study recommended the Nurse Licensure Compact to be implemented nationwide in order for nurses to work across state lines and help in times of need. Next is the role of public health nursing. During emergencies like COVID-19 or natural disasters, nurses are often the first point of contact for vulnerable communities. Their presence improves access to care and helps prevent unnecessary complications or deaths. Lastly, training makes a huge difference. A study from the Journal of Nursing Management in 2024 found that when nurses completed structured disaster training, they were more confident and better prepared. This, in turn, led to quicker triage, fewer errors, and faster stabilization of patients. In short, investing in preparedness saves lives. Next, we're going to shift to nursing leadership and management during disasters. Strong leadership plays a critical role. Nurse leaders must think strategically, communicate clearly, and work well with other professionals. This kind of leadership ensures an organized response during chaotic times and triage situations. Resource management is another key piece. Leaders need to plan for shortages like PPE or medications and figure out what their team needs and how to get it. Nurses working in disasters often face emotional exhaustion. Leadership must build in mental health support systems, like Erin was talking about, to protect staff well-being and maintain resilience, especially during these situations. And finally, as mentioned on the previous slide, training and preparedness is essential. Leaders who provide regular disaster drills and cross-disciplinary simulations are setting their team up for success when disaster does happen. These leadership strategies don't just support the nurses, they also directly impact quality and safety of patient care during these disasters. And next is Nicole.
Okay, so why is disaster response relevant to healthcare leadership and management? Preparing and planning during disaster response. Disaster responses need leaders to develop, implement, and oversee emergency protocols. Leaders are responsible for making sure staff are trained, resources are allocated properly, and coordinated with emergency agencies to implement protocols. Decision making under pressure and critical situations. According to a study by Losty and Bailey during the COVID-19 pandemic, having a leadership presence was crucial during disaster response. During emergency situations, healthcare leadership and management arose because some became leaders while others became followers. Flexibility in nursing leadership style was key in decision making under pressure because it allowed nurses to make decisions that affected their work while listening to frontline workers and providing support. According to the same study, leadership presence may not be as tangible as people think. However, when it is absent, it is easily felt and recognized. Informal leaders arise, creating a ripple effect that allow other staff to become leaders as well. Disaster response is relevant to healthcare leadership and management because there needs to be a group of people to take charge and display key abilities to achieve desired impacts. Ethical and legal oversight. This topic is relevant to healthcare leadership and management because there needs to be regulation even during critical situations. Management oversees justice and fair allocation of resources through triage protocols that prioritize care based on benefit and likelihood of a positive outcome. This is important when there are scarce resources, such as during COVID with ventilators or ICU beds. Leadership and management must overlook regulatory compliance and making sure actions comply with laws and guidelines implemented by the CDC, state health departments, Emergency Medical Treatment and Labor Act, and others. Hospitals may activate crisis standard care during situations where legal and ethical expectations are adjusted. Therefore, oversight by leadership and management is important for appropriate and consistent standards of care. So now on to the impact on practice of professional nursing, public health-based care. Disaster responses impact the practice of professional nursing through a shift from individual focused care to broader public health perspective or population level care. There's an expansion of nursing responsibilities as nurses take on more tasks through triaging, crisis intervention, and clinical decision making as healthcare workers are spread out and may become unavailable. Nurses must be well prepared and familiar with emergency operation plans in order to take on the expanded scope of practice during emergency protocols. Collaboration. According to Anderson and Beach, first responders involved with disaster response are often required to take the Federal Emergency Management Administration course on the Incident Command System. Nurses need to advocate that this should be a common component within nursing education to prepare nursing students entering the field on disaster response. This not only prepares nurses for response activities but facilitates collaboration and communication among healthcare workers. Policy development and protocols. During natural disasters and pandemics, such as the one we recently faced, nurses are some of the workers during these responses. Proper education is needed to prepare and intervene appropriately during emergencies. Preparation is not just protocol and interventions, but nursing students need to know how to mentally, emotionally, and ethically prepare for disasters. Nurses provide critical knowledge in educating nursing students how to respond, where to find resources, and how to collaborate. It is important to integrate protocol training in professional nursing so nurses can be prepared and improve patient outcomes. Nurses also provide crucial perspective as to how hospitals can modify protocols to better respond during disaster situations. Adequate training fosters preparedness, professional confidence, and patient safety in disaster response, such as natural disaster, pandemics, or mass casualty incidents. And now on to Olivia.
All right, so relevance to professional nursing. This topic is relevant to professional nursing because VNEMA 2017 emphasizes that disaster preparedness is not just an optional skill, but a critical component of professional nursing practice. The article calls for national action to formally integrate disaster nursing education into nursing curricula and professional development programs across the U.S. The author argues that nurses are often the largest group of healthcare responders during emergencies, yet many are not adequately trained to manage these complex demands of disasters. These situations may include mass casualties, pandemics, natural disasters, or bioterrorism events. The lack of standardized training leaves both nurses and populations they serve at risk. This article outlines several key areas where disaster response is relevant to nursing. Direct patient care. Nurses are frontline providers during disasters responsible for triage, critical care, and stabilization under chaotic conditions. Leadership and coordination. Nurses often take on leadership roles in emergency planning and resource management during disasters. Public health and safety. Nurses help implement infection control, vaccine campaigns, and health education in the community. Ethical decision making. Disasters require nurses to make tough choices about resource allocation, care priorities, and safety, which are all within ethical framework. This journal calls for a national framework of core disaster competencies for all nurses. They assert that without this, the profession risks being unprepared for large-scale emergencies, which would compromise the safety and outcomes of patients and communities. And to summarize, what we discussed, ethical and legal challenges. During disasters, nurses face tough ethical decisions like how to prioritize care with limited resources. Legal concerns also come into play, such as scope of practice changes and liability when working in emergency conditions across state lines. Financial and regulatory issues. Natural disasters strain hospital budgets and resources. There may be sudden staffing shortages or emergency spending needs. FEMA and local government regulations can impact how and when care is delivered and what funding is available. Social and political issues. Disaster response often highlights healthcare disparities. Vulnerable communities tend to suffer more. Political decisions about funding, evacuation plans, and emergency preparedness can directly impact nursing roles and effectiveness. Impacts on patients and leadership. Patients may experience trauma, displacement, and interrupted care. Leaders must respond quickly, communicate clearly, and coordinate teams under pressure. Nurses are expected to remain calm and act efficiently despite the chaos. Relevance to healthcare. Disaster preparedness is essential to healthcare. Systems must plan for mass casualties, loss of power, water, supply shortages, and surge in patient needs. Nursing is on the front line in these situations. And then impacts on and relevance to professional nursing. Nurses are vital in disaster planning, response, and recovery. Their roles extend beyond the bedside into triage, community education, policy making, and advocacy. Ongoing training in disaster nursing helps ensure patient safety and system readiness. And then these are our references and our 5 journal articles. Thank you.